Welcome, my name is Janet Schloss. I'm a clinical nutritionist and I've been working with people for cancer for over 16 years. To give you an idea, I wanted to explain the difference between a clinical nutritionist and a dietitian, because dietitians also work with people with cancer, as do clinical nutritionists. Our profession as clinical nutritionists look at diets in a slightly different way, as we look at it as the metabolic type things and physiological reactions that foods can actually occur, not just calories in or calories out, or how much we actually require for those people who actually have cancer. Obviously, with people with cancer, we still have to take in consideration their ability to swallow, the ability to digest, what treatment they're actually going on, and how they're progressing with their disease, or if they're surviving with no disease. So to give you an idea of what clinical nutrition actually is, we look, as I said, in regards to certain foods and their activities. So things like might actually be things like turmeric and ginger, which have natural anti-inflammatory agents, which are a really good aspect to be able to put into people's diets to decrease general chronic inflammation. In addition to studies that have shown that ginger in particular can actually help with osteoporosis, so increase of bone deposition, which is obviously a major problem for a lot of people with cancer because of the decrease of bone density during treatment like chemotherapy, hormone treatments, and also for aging population. Other examples of this is that there's certain diets and constituents in certain foods, such as omega-3, which we can find in certain fish, in like salmon, sardines, which are a benefit to keep in our diet. There's types of diet, such as the Mediterranean type diet, which is also one of the things that some of the dietitians will actually put your people on. There's the DASH diet, which has been trialled for people with breast cancer, with estrogen negative, having positive results. So there's types of diets as well. There's a wheel diet as well, and including things for like prostate cancer, bowel cancer, which has also been found to have a high incidence of 50% risk factor with dietary and lifestyle factors. So clinical nutritionists will actually look at people's diets, have a look at where they are in their stage of treatment, say like if they're actually going through chemotherapy, if they're going through radiation, hormone treatment, or if they're actually in maintenance or having different surgeries. That has to look at an individual's profile, so what type of foods that they actually like, how they're responding to treatment, like if their tastes changed, their smells actually changed, certain foods that may actually feel different when they're actually on treatment versus actually after, things that may actually help decrease some of the side effects that they're actually going through in relation to, say, like hormone treatments. You may actually have a higher increase of, say, joint pains and muscle pains. We look at, say, vitamin D, which if it's actually low, can have a clinical manifestation of having joint pains as well as muscle pains. So then we might actually consider supplementation in a slightly higher dose. And that's one of the things that clinical nutritionists do, is certain supplementation when required to assist with certain side effects or lifestyle reactions. So what we actually look at is not just their diet, their amount of calories that they're actually intaking, and the types of breakdown with their micronutrients, their macronutrients. It's also about the types of food. So there's certain studies that have actually found that this particular type of food, like I've said, like some of the cruciferous veggies, some of the berries and stuff, have particular interest for particular cancers. Another example of this would be, say, the lycopene, which is a tomato-based one for prostate cancer. So people have been found to increase that amount. Another study actually found that the skin of chickens and eggs were associated with an increased risk of prostate cancer. So it's looking at those type of things to incorporate into their actual diets. So overall, a clinical nutritionist will first of all look at the individual, look at how they're digesting foods, look at their whole being, as in what physiological symptoms and biochemical symptoms that they're actually experiencing, what stage of treatment that they are within their actual cancer, how can that be of benefit to them, what's going to be the best foods for them at this particular stage, what type of nutrients would be best suited for them at that particular stage, and then develop it from there. When's the best time to see a clinical nutritionist? When you're looking at cancer, it can actually be at any stage. Probably not best just before surgery, but post-surgery, during chemotherapy, during radiotherapy, during maintenance, during survival, all good options, because each stage has a different clinical benefit when we're looking at nutrition. I hope this has helped you. If you have any questions, please contact us and we'll be able to answer them.